Alright guys, this is one other video that we're doing about dental implants. Very similar cases that we're finishing up, but at the same time very different. Alright, so I'm going to start with this case here. So that's a one-piece implants. Alright, we call it a hybrid. So we have just 4 implants, as you can see. Some people call it all on 4. But that's just for you to see the advantages and disadvantages of treating cases. All right, so you have 1, 2, 3, and that's the other access hole to screw that implant or that prosthesis into the patient's mouth. So those are porcelain teeth. Okay, as you can see, the translucency, the texture, the detail, so it's not one tooth color all the way from the top to bottom. So very anatomical, very natural, and we just basically have, in this case, 4 implants placed. There's no roof of the mouth covered, and we screw this piece in the patient's mouth. All right, and then I am, or the dentist or the specialist, are the only one that can take that one off. Right, we're going to teach you how to clean, how to maintain, and whatnot on those cases. So of course we're going to put this tooth in. So, and that will be just basically invisible. All right, so that's one case. So some people call it all on 4 hybrid, but this is not made out of a plastic or denture teeth that most cases people do. This is another case, very similar, but instead of having 4 implants, we're talking about 8. Okay, so you see all the access holes here, and you can count 8. They're again made out of porcelain or ceramic, whatever you like. You have a little bit of a pink porcelain because that makes the natural looks, that makes nobody will see or notice that you have fake teeth. All right, so you can see the texture again on, and the anatomy and the detail that is put into the prosthetics. So this will look extremely natural to the patient's mouth and feel. So I'm going to remove them just for you to see this. In this case, we're talking about 3 pieces compared to the other one, which was just 1, right? So that makes it a little more cleansable. You know, if something happened, it's easier to manage, and we go from there. So you can see here, this scalloped gum, if you can imagine this being the gum. So this scalloped gum was developed by me basically over the course of the healing time. So the patient was wearing temporary teeth, basically very similar to this situation. and yeah. So you see, so that makes it again more cleansable and way more cosmetic, because you're not going to have flat teeth. You're going to have, you know, just like you would in a normal mouth. You have those papilla going towards your mouth and whatnot. So you can see here what we developed over the, you know, the course of the healing time. The implants were placed beautifully. You can see different color schemes, but that's basically the gum. Compared to this one, so this is a one piece, so it's a different approach than this one. Now, what's the benefit of doing more implants or less implants? Well, one, depends on the anatomy, depends on what the patient wants, depends on the bone structure, depends on the surgeon, depends on what the patient wants. Now, this is a little more cost effective than this, because for starters, you just have 4 implants. On the other hand, you have 8, right? This, it's a little bit harder to clean because you have 1 piece. Rather this, you have 3, so it's a little easier to work with. If something happened, God forbid something happened, this, you're a little more in trouble. It's a little more challenging to fix. This is a little easier and cheaper to fix. So there's a trade there where you can have some comparables, but you can see how nice and how beautiful the gum is displayed and whatnot. So those are the 2 big cases that we're working on. We're delivering it today, and you can see how the gum looks like it, and it looks very different. So all of this gonna be covered by your gums, and that's what you're gonna end up seeing. And it works and functions like natural teeth. It's amazing, and how wonderful it is to wear those things. Those holes, if you're wondering, we're gonna close up with a filling material, a composite material, just like you do if you have a cavity. It's the same material, so nobody ever gonna see those little access holes once it's sealed. And yeah, patient will be as happy as it possibly can. All right, so if you're curious about it, thank you so much for watching this video. Give us a call, schedule an appointment. If you have any questions about implants, DM me, and we'll keep in touch. All right, thank you so much. Have a good one. Bye.